For joining us. 3 people in the southern part of the state have now died, and unlike most outbreaks, this one's targeting young people. ABC4 Utah's Kim Johnson is live outside Intermountain Medical Center with what you need to know to keep your family healthy. Kim.
Yeah, this year the flu is not only a danger to the very young and the very old. Nationwide, more than 60% of flu patients who end up at the hospital are between the ages of 18 and 64. It's a trend seen here in Utah as well. Now doctors hope the younger, healthier crowd listen up. Remember the swine flu? It's back and proving deadly in Utah. In just the last 2 weeks, there's been 3 H1N1 related deaths in Washington County, all 3 under the age of 65.
We're seeing severe cases in younger people than we usually see them.
Medical experts theorize older people received immunity when the H1N1 strain dominated in 2009.
Older people, meaning, say over the age of 50, had previous immunity from when similar strains were circulating many years ago. And the people who are in their 20s never had that exposure, never had the immunity, never developed the immunity, so they're being hit a little bit harder.
This year in Utah, the flu has hospitalized 48 people, some of whom are young and seemingly fit.
We certainly see normal, healthy people getting severe flu.
Dr. Eddie Stenehjem at IMC says flu hospitalizations of healthy people usually stem from a lung infection.
Sometimes H1N1 virus can actually infect the lung tissue in itself and cause a severe pneumonia. And in that case, respiratory failure ensues. So generally people, when they die of H1N1 or really any influenza virus, it's respiratory complications and respiratory failure where they can't get the oxygen to their body because of the damage in their lungs.
Why the flu can lead to respiratory failure in one healthy person but not the next remains a medical mystery. The good news, doctors say a trip to the hospital can be prevented with a flu shot. This year's vaccine includes the H1N1 strain, and with the flu season peaking in January and February, it's not too late to get one.
If we're still seeing flu, you should get vaccinated if you haven't.
And we should note that the vaccine takes approximately 2 weeks to kick in, so if you do want to get one, the sooner the better. And with the inversion expected this week, those nasty particulates can make any respiratory illness even worse and increase the instances of having to come seek treatment at the hospital. Live in Murray, Kim Johnson, ABC4 Utah.